You're watching Baptist Health's Resource Live, where our respected experts bring you timely and practical health and wellness information to improve your family's way of life. We're healthcare that cares. This is Resource Live.
Hi, everyone. I'm Dr. Jonathan Fialkow, Chief Population Health Officer at Baptist Health South Florida. Every fall, health experts urge us to get vaccinated for the flu. This year, in the midst of the COVID-19 pandemic, this message needs to be shouted from the rooftops. There are conversations, as we know, that can be emotional and political, but no matter how we discuss this, we still have science and facts. Today, we're joined by a panel of experts to discuss some critical concerns about the upcoming flu season and provide information about how you can protect your family. Joining us today are Dr. Maria Ordonez, primary care physician with Baptist Health, Dr. Ladan Pourmasiha, Medical Director, Baptist Health Urgent Care, who we will affectionately call Dr. P for the purpose of this conversation, and Dr. Aileen Marty, Professor of Infectious Disease at the Herbert Wertheim College of Medicine at Florida International University. Thank you for joining the discussion today, guys.
Thank you.
Thank you for having us.
Thank you very much.
Before we dive into today's subject, I want to remind our viewers to send in any questions or answers throughout the segment. We're here for you and happy to answer any questions at the end of the segment or through the segment. Let's start the conversation with Dr. Marty. Aileen, broad question. We could spend hours, probably weekends of conferences, but for the purpose of our viewers, what is the difference between the flu and COVID-19?
The thing that most people need to understand is that while flu can be a deadly disease and cause very significant respiratory and sometimes gastrointestinal and sometimes, an aspect of systemic disease, COVID-19, which is caused by the SARS-2 virus, is a lot more intense and causes a lot more complications in a very high percentage of people who get infected. And it also has a lot of post-infection complications. In fact, many people continue to live with those complications after they come out of the hospital. In fact, Boris Johnson from the UK, who was hospitalized for COVID-19, is one of these long-term sufferers. And of the mortality rate, the death rate is also a lot higher with COVID-19.
So while flu is certainly prevalent, and we always hear tens of thousands of people die of flu every year, they do. Can you add a little bit about how the flu is a burden to our healthcare system, but not as much as COVID-19 has been shown, especially in pockets where it's been more prevalent?
There's no question, Dr. Fiscal, that we have had a much higher incidence of hospitalizations, people in ICU very severely ill with the SARS-2 virus than we ever have with influenza. Even in our worst seasons, we would never get in just a few months to over 200,000 deaths like we've had with COVID-19. Also, of course, we do have effective antiviral treatments that work specifically, many different ones actually, for influenza, whereas we're still experimenting and have only one remdesivir that's an actual antiviral that has some effect on some patients with COVID-19, and then some ways to mitigate. Another factor which makes the COVID-19 very different from influenza is the extent of the overactivity of the immune system. And this ridiculously overactivated immune system is what we try to calm down when we use steroids like dexamethasone.
Thank you. So while we want to impress upon people the seriousness of this COVID-19 pandemic, we don't want it to be equated to the flu, but now let's talk about why influenza remains a major concern and why we want to message our viewers to take it seriously and get the vaccines, and et cetera. So Ladan, maybe I can ask you your experiences working in an urgent care. Person comes in with symptoms. How would that person know whether it's influenza or COVID-19? How would you, as the provider who's interviewing or evaluating the patient? And then the third question, if it's not too much, is do you handle them differently? If your suspicion is it's influenza, what would you do? If your suspicion is COVID-19, what would you do?
Well, to be quite honest, right now with the pandemic and everything going on, we have to be safe. The patients have to be safe. We have to be safe. So at this point, we have to assume, especially in an urgent care setting where everybody's coming in, that everyone may have COVID. So we always have to wear our personal protective equipment. We're always prepared to treat patients in a very safe setting. We always want to adhere to the social distancing. So in that note, we kind of treat every patient as, are they a potential COVID? Now, as far as telling the difference between the two or the similarities, unfortunately, they're both respiratory viruses, so they kind of present very similarly. So this is where we need to do some testing, and testing may be required. Luckily, at our urgent cares, we have urgent cares in the Miami area, we have it in the Broward area, and so forth. And all of our urgent cares are able to do both the influenza testing as well as the COVID-19 testing. And generally what we're doing is 3 major tests in the urgent cares. One of the tests is the PCR test that we are doing. And this is pretty much the gold standard that the CDC is recommending. And we're getting about a 3-day turnaround time. And what that's basically doing is that it's looking for the genetic material of the virus. And in this particular case, some of the patients may not even be symptomatic, and we're testing them with the PCR. In the other cases that we're actually seeing is we're doing the rapid test, and this is our antigen test. And this one particularly looks at proteins on the virus's surface. This test has been a godsend for the patients. They come in, they're like, I want to know right now. Well, we have 15 minutes for that test to come back, and that's great for the patient. But the key thing to understand about this test is that you have to be symptomatic. And this test has been shown to be accurate about 97%, but you have to be symptomatic within a 5-day window period. And then the third test that we do offer is that IgG antibody test. And this patient comes in, they either want to get on a flight, they either think that at some point they had COVID or they were exposed to someone, but they're not currently having any symptoms. And so we test them for that antibody as well.
So if an individual's at home with symptoms, or a family member has symptoms, is there a way for them to almost make an appointment, or they have to just go to the urgent care and wait? Are there ways to kind of, anticipate and help them? Yeah.
Absolutely. So like I said, we've been trying very, very hard to kind of social distance, keep the waiting rooms as empty as possible. A lot of times we even have people wait inside the car to keep them safe, to keep other patients safe. And so there is a Save My Spot that they can actually get online, and you go ahead to Save My Spot, you schedule a time, a date, and you're able to come in, be seen, and hopefully quickly in and out.
Right. And I think the point you mentioned, which is something we've iterated and reiterated, is with the social distancing, with the proper precautions, people are not getting sick by coming to urgent cares, emergency rooms, doctors' offices. In fact, the risk in the community is higher. So if you're sick, get yourself taken care of. Thank you.
Something real quick.
Oh, of course.
Yeah. So one little clue that it's more likely to be COVID and less likely to be flu is this anosmia, this sense of loss of taste and smell that's particularly common in coronaviruses, other coronaviruses too, but it's just a little hint that that's what's going on. And by the way, it's interesting, now some of the people who have recovered from COVID, if they recover their smell, seem to have an off smell. So things that used to smell delicious now smell horrible. And so there's a continuing problem with smell involved with.
Is there an age-related component to that, or it can happen to anyone with COVID? Maybe it's more. I see it more in our younger folks, 20s, 30s, 40s, so younger than me. But does it happen in older people, but they have other symptoms that maybe become more prominent, or is it just in the younger people?
No, it is seen more in younger individuals than in older individuals. And it's often the only symptom in people who are otherwise asymptomatic, or they think they're asymptomatic, although we can detect changes if we do films and other studies.
So, Dr. Ordonez and Maria, first question is, do you see in your clinical practice, are you seeing younger people with purely the anosmia, the loss of smell? And then secondly, for you and in our medical community, why is this flu season something that we're more concerned about than the average flu seasons, which we know are dangerous and take lives and lead to morbidities? What do you think about this one? Yeah.
No, definitely. And I wanted to add also to the loss of taste and smell. I used to do urgent care before coming here, and I had it, and it was my first and main symptom was the loss of taste and smell, and it actually lasted for like 4 weeks after all my symptoms were gone. And to your point, that was my my main thing. It's like for like 2 months, things would taste just different than they used to before. And then, yeah, many of the patients here in primary care, we screen them. So usually they have symptoms. We're not seeing them in office. We do like a telehealth, but via telehealth, that's one of the complaints: loss of taste and smell, some body aches, some fatigue. Yes, so we are seeing that here. And then to your other question, why is it so important this year? It's because, and we may touch on this later, coming flu season, we're going to see this year both COVID and the flu come. And so, especially for everybody, but also people that are at risk will be at higher risk. And then on our healthcare system, Dr. Marty spoke about like the impact it'll have on healthcare and the higher morbidity and mortality. So it's more important for everybody to do their part, right? Starting with washing their hands, social distancing, everything, all the precautions, and also getting the vaccine, which is one of the our main method for prevention on the flu.
I appreciate that. I'm actually going to ask a question that's a leading question. I'm going to ask of each of you. The average person looks at this COVID-19 pandemic through the eyes of what it means to me or their family member appropriately. I don't want to get sick. I have problems with work, maybe financial issues, but we see at the tip of the spear the stress on our healthcare systems. If nurses get sick, there's no one to take care of people at the hospital who have COVID. People, of course, in New York, Milan, the experiences where we had these major centers were dying from non-COVID related medical problems, heart attacks and strokes, possibly because they couldn't get taken care of. Can you each speak for a second about the importance of not just the message to the listener, we don't want you to get sick, but the reason that we as a system and as a society really have to control this is to not overwhelm our healthcare system where there's no beds for sick people or people are sitting on ventilators for long periods of time. I'll start with Dr. Marty. Aileen, can you comment on that? The healthcare system stress from this whole situation? Why influenza can make it worse?
Yeah, the stress on the healthcare system is absolutely paramount. If we have too many cases for the number of staff that we have, the number of beds that we have, the number of equipment that we have, number one, we cannot give the attention per patient that each patient deserves because there are so many extra people. Number two, our staff get fatigued. Right now, there's a tremendous problem with staff fatigue because of how many months we've been dealing with this horrible pandemic. Number three, things can get confused, right? So you have this situation where you have multiple viruses coming in that look similar, and mistakes can be made when there are a great number of cases. This is a complicated problem, and for our well-being, for the well-being of society, we need to put a damper on this. And going back to your previous question about getting the vaccine for influenza and why we have to worry so much, remember, COVID-19 is a virus that the SARS-2 virus is a virus that will lower your immune defenses. So when you have a dual infection, your entire clinical picture is much worse than if you have one or the other. So you definitely want to control for whichever one you can control, or both if you could. Right now, we can control for influenza with the influenza vaccine. So you definitely want to get that out of the picture so you don't have a dual infection, and also so you don't have that confusion factor. So that's another really important reason why we want to diminish the risk of influenza.
And that is the social contract we all have to our viewers. Again, you don't want to get sick. You don't want a loved one to get sick, but it's what this means towards our healthcare system and to others involved in that place. Ladan, you want to comment a little bit about that, what the stresses you've seen, especially in let's say, your experiences when we're at the peak, and hopefully won't have that similar second wave come through?
Absolutely. So, the way that I see it is, if you help protect us, we can protect you. When all this started, all our healthcare providers, they were just doing everything that they could to go out there to help, to provide the healthcare that the patients needed. But unfortunately, there was a point where PPE was low and there were things that we didn't have control over. And so the whole point of social distancing and the whole point of everybody staying home was to give us enough time to be able to not just learn about COVID, because it's such a new thing to us, but also prepare our facilities, also be able to get that equipment so that we could properly take care of the patients and give them what they need. And so, of course, there was a point in the urgent care where we were very, very overflowed with patients. And luckily, we were able to do what we needed to do. And we were able to come up with new ideas every day as to how to keep the patients safe, how we could keep the facility clean. But yes, it's definitely a stress on the healthcare system. And, when I say protect us so we can protect you, our healthcare professionals, may have gotten sick. And so we did have to have other people fill in. And so it just made things a little bit more difficult. And I think we're right on track now. And I think that that's where we need to be. We need to continue to just, be very mindful of the things we've learned and to abide by those rules that we've made thus far to keep us on the right path.
Thank you. And Maria, anything to add on that? I know it's all been well said. What you've seen as the impact on our healthcare providers, physically, emotionally.
Yes. No, and I wanted to make a comment, yes, on the impact, for us, as we learn also and try to get the patients, right, to give them the guidance and give them the education. And also what I see a lot is people, and you mentioned this a little, trying to wait a long time before they're seen or before they get medical care because they're scared, right? They're scared of getting it. So we're trying to be as safe as possible, right, in our facilities, in the hospitals. But there were a lot of people waiting with maybe like chest pain or waiting with other concerns. And so that's also overwhelms the healthcare system, because then you come in with more complicated conditions, right? Abdominal pain or something else. If it's something that needs to get looked at, we urge patients, if you need some education, or you want to talk to one of us, do like initially a telehealth visit, or get into an urgent care, or call your primary care provider and talk to us, or come in, if you need to go to the ER, go. They're taking all the precautions to not wait till the end when you can have something more complicated.
Thank you. Let's get to vaccines a little bit more specifically now, since of course the goal for the flu season is for people to be vaccinated for the reasons we discussed. Aileen, I'm going to ask you about public health policy and recommendations, then go to Ladan specifically on resources that Baptist Health will offer to the community. And then Maria, I'll go to you more specific towards our employees and what we're doing, and maybe some other community opportunities. So Aileen, what is the public health recommendation for flu vaccines?
For many years now, the public health recommendation is everyone 6 months or older should get an annual influenza vaccine. There are actually many different kinds of influenza vaccines. There are egg-based vaccines, there's cell culture vaccines, there's recombinant vaccines. There's one that is a live attenuated vaccine that we halted the use for a couple of years while it was improved, but that attenuated vaccine is available for people who don't take a shot. Because there are vaccines for influenza that are not egg-based, having an egg allergy is not a reason not to take a flu vaccine. You simply take either a cell-based or a recombinant vaccine instead. There's also flu vaccines that have 4 different strains, and some vaccines that have only 3 different strains. In general, most of us should opt for one that has the 4 different strains, because what we do every year when we create the flu vaccine for the year is we do a survey of what's going on in the opposite hemisphere as to what's circulating and which viruses, which particular influenza A's and B's might be circulating amongst us. And when we guess properly, the flu vaccine looks phenomenal because we've covered the right strains. When we don't estimate quite exactly which one's going to circulate, or when there's drift or shift in the virus, then that's when it seems that the flu vaccine isn't working as well.
So I hate to ask these questions, but we have to. Can you get the flu from getting the vaccine?
No, you cannot get influenza from getting the flu vaccine.
End of story. Everyone.
No. There is another part to the story, and that is that because your body is going to react to having that vaccine with what we call innate immunity, some of that gives you some of the symptoms that people associate with flu, right? Some of the I don't feel goods. And so, but that's not the same thing as actually getting influenza. So you might not feel very well for a day or so, some individuals, but that's not the same thing as
And
getting.
similarly, you can get the flu vaccine and 2 weeks later get a just regular respiratory cold virus and be sick. It's not the flu, and it was not what the vaccine's there. So I have a flu and I just got the vaccine. Not the same type of thing. The influenza is the specific we're talking about. What about you did say, and I want to harp on this, everyone should get it over the age of 6 months. It's not only sick people, only people with other medical problems. It's for everyone, both so they don't get it, but they also don't give it to other people. So that everyone can vote it, right?
That's right. There are still, of course, some exceptional situations where certain types of underlying conditions you might want to speak to your medical provider. But because there's such a variety of different flu vaccines, there's pretty much one for everybody.
And Maria, flu vaccines are available for your primary care doctor, who will be able to tell you how and when to get it, right?
Yes, they are, and we have them available in clinic. I wanted to add a little point to what Aileen was saying, because it's not only, yes, because many patients in primary care, right, we recommend it, and they're like, I don't get the flu shot because then I get some symptoms and I'm going to get sick, right? And so what you explained, right, you do have this a small reaction like to every other vaccine. You can get some soreness, right? So maybe a little bit of fatigue, right? But that's less than what you would get with the flu, right? They usually go away in a couple of days. And then the other one is, even if you get the flu, the vaccine can prevent from having a lower severity of illness. So even if you do get it, it does give you protection to not get such a severity of disease. Studies show even if you are admitted to the hospital, you have less of a hospital stay, less of ICU stay. So still, even if you get sick from the flu, you still have more protection, better protection than if you didn't get the flu shot.
Thank you.
Can I dovetail on what Maria just said?
Sure. Yeah.
Because she made such an excellent point. She reminded me of another important point about influenza vaccines, and that's study after study showing that because you don't get the flu, you don't have a whole bunch of different cytokines that put you at risk for stroke and heart disease. So it's actually protective against cardiovascular disease to take the flu vaccine.
So no one's going to argue that shouldn't get the flu.
Lower rate of cardiac events in people with heart disease, less, exacerbations of COPD, their diabetes, everything. So chronic conditions also help. Yeah.
So Ladan, what is, if you can tell us, what is Baptist Health doing, and what are the resources available for the community and for as regards to flu vaccines?
So our goal and our mission is to just tell everyone to be very proactive about their health. At the end of the day, that's the most important thing that we have. And so to take part in that and to also let people know that we care about your health, we decided to offer the flu shots ourselves. And we're going to start offering them starting September 29th. And as long as they are available, we're going to have them in our 24 urgent cares. And this is our urgent cares as well as our express cares. And this is in Miami, this is in Broward and Palm Beach. And we're going to go ahead and have you guys just come in and get those shots. Now, it's a very seamless process. We're trying to, like I said, safety is one of the biggest things that we're trying to make sure that we can have handled. And all you have to do is go to baptisthealth.net/flu, and you go to Save My Spot. You get an appointment, you schedule your time, your date, and you're able to come in and be seen and get that vaccination. And I'm just going to piggyback off of what we were talking about as far as the vaccines. We are actually vaccinating children as young as 6 months old up until our senior citizens. We do have vaccines that are high dose vaccines and preservative-free vaccines as well. And so the key message here is we've got the vaccines. We're in the middle of a pandemic. This is something that we have to protect you against the flu. And one of the complications from the flu are pneumonia. And in the urgent care, with my COVID patients, lo and behold, it always comes back as the individuals that are higher risk are getting the pneumonia. So if we can do something like giving the flu vaccine that we have out, then maybe we can prevent any complications if people end up getting both.
So free flu vaccines starting September 29th at all Baptist urgent care facilities.
as well as the express cares.
Appointments can, and express right urgent cares, and appointments can be made, which really lowers the threshold one has to cross to be able to get the flu vaccine.
Absolutely. And the idea is people are so scared to come to an urgent care because they think, okay, urgent care, ER, it's exactly the same thing. So, but in reality, like I said, we're taking a lot of measures to try to see if we could get you in and out like an appointment, just in and out so that you can get what you need to get and stay safe and protect yourself, protect your family, and protect the community.
Great information. Maria, why don't you let the listeners know, just to get some perspective of the scope and scale of the Baptist policies for our employees, and what other support there might be for flu vaccines.
Yeah, definitely. So at Baptist, everybody gets a vaccine. So the whole team, the entire workforce, there's mandatory flu shots. We all get our yearly vaccine, about more than 23,000 people. Baptist also
23,000
yes
employees in the Baptist
23,000. So
flu
everybody getting the flu vaccine. Also, Baptist is passionate about donating and making sure we have it available to the community as much as we can. So in our urgent cares, in our primary cares, in our express centers, about making it accessible to everybody because of their big role in prevention, vaccine role in prevention of the flu.
Great information. For the last few minutes, I'll go through with a couple of you some other quick questions that we tend to get in our practices or from the lay public. I'll open it first to Dr. Marty. Can pregnant women get a flu shot?
Yes, they can get a flu shot, and they should.
They should.
In fact, pregnancy is one of the things that puts you at higher risk for complications from flu and from COVID-19.
If someone has COVID-19 or they've had COVID-19, should that mean they don't need the flu shot?
Absolutely not. Those are not related. Very different viruses have a different immune response completely.
And you had mentioned, and we're quite concerned, people can get both at the same time, which would be a really more serious condition for either one of them by themselves.
That's right. And actually, we've been tracking that, what's going on with COVID and dual infections in the United States. Not just flu, but also bacterial infections become more complicated if you also have COVID-19.
Fair enough. Maria, if someone is staying at home in the bubble, do they still need to get a flu shot?
Yes, and it's a question we get here in the primary care office. Yes, because one, people can still pass viruses and pass the flu before they get sick, before we know they have symptoms. Some people say a bubble, but maybe they see one or two family members, right? Maybe they go out for errands. And still, even if you're avoiding people that are sick, or if you're avoiding everything, right? People that even before they get sick, they can pass the virus. The first few days of illness, some people are asymptomatic or have very mild symptoms and never know they're sick. And then also we know sometimes it can be transmitted through objects, so something you grab and then you touch your face. So still, because of their big role in prevention, yes, everybody should get a flu vaccine.
Ladan, when should people get the flu vaccine, and is now a good time to do it?
Absolutely. Right now is a very good time to get the flu vaccine. We usually want the patient to be asymptomatic when they're getting that flu vaccine. So that's one of the things that we ask. But as far as the flu vaccine, like we mentioned earlier, this is something that's going to help us, especially in this time that we are in a pandemic. And, we urge people to go out, get that flu vaccine, and don't worry about all the myths that are out there. It will help you in the long run.
Thank you very much. You guys have all been fantastic. In the interest of time, I'll ask if any of you have any final comments to either bring up points that we didn't get to or emphasize something that we did get to. I'll start with Dr. Marty. Aileen?
Hey, the same things that apply for prevention of COVID-19 apply for influenza. So wash your hands, use your masks for now, keep that 6-foot distance, avoid crowded places and indoor spaces.
Great. Ladan?
Same thing, that social distancing, wearing the mask, washing your hands. We really, really would love for you guys to abide by that. And as far as in the urgent care, like I said, we do these testings. And if you guys have fevers, or if you have been exposed to somebody that may have the flu, or in a household that someone may have the flu, please come in and see us. The antiviral medications that we do have work best if they are given within the first 48 hours of symptoms. And so that's a very crucial time for us to be able to evaluate you and possibly treat you.
Well said. Thank you. Maria?
Yes, no, what everybody has said, social distancing, wash your hands. Also, 6 months and older, get your flu shot. And if you have any symptoms of respiratory illnesses or anything else, don't wait till the end. Let us see you beforehand. Reach out to your healthcare providers, and we're here at Baptist.
And I will add, and think of the healthcare providers who remain at the front lines for all medical problems, but specifically COVID-19 pandemic and influenza. Well, this is great. I want to thank everyone for taking the time to sit down and talk about this important topic. It's really very much appreciated. On behalf of Baptist Health South Florida, we encourage all of you to get your free flu shot soon. Free flu shot soon. Please don't let your guard down when it comes to the coronavirus pandemic. Stay safe. Do your part to stop the spread of COVID-19. Mask up, South Florida. Thank you all.
Thank you.
Find additional valuable health and wellness information on our resource blog at baptisthealth.net/news. And be sure to interact with us on our social media channels for live and upcoming events. Resource Live is brought to you by Baptist Health South Florida. Healthcare that cares.